Good afternoon and welcome to everybody that's currently joined us. We're going to give it another couple of minutes just for a few more people to join who are just getting to connect to WebEx, and then we'll be starting our session. If you're connected on your laptop or on your iPad, you can communicate with us in the chat box in the bottom right hand corner, and we're looking forward to you asking lots of questions and sharing some of the stuff that you're working on. Please feel free to say hello. Okay. Great to see so many of you joining us already. Just going to give it another minute and then we'll get starting on our session on AI and health and social care. There's a few people still trying to log in. Okay, look, it's gone just after 1 o'clock. There's a few people still trying to join, but let's get started. We've got a lot to cover today, and looking forward to learning from you guys as well. So first off, welcome to the first AI in Health and Social Care Community and Interest WebEx. My name is Dominic Cushnan, and I'll be your co-facilitator today with John Callas, who I'll introduce shortly in a moment. Throughout the session today, I will be asking you to contribute both verbally, and obviously we can't have everybody speaking at the same time. We'll be using the chat box that's built in WebEx, so it should be in the bottom right-hand corner of your screen, where you'll be able to message each other, introduce yourselves, and be able to interact with us as well. Now, we have a couple of norms just to enable us to have a better conversation and be able to follow some of the threads. So, for example, if I'm leaving a comment and you wanted to respond directly to me, it's really helpful if you use the @ symbol on your computer with my name, Dominic Cushnan, or @Dom, to reference that you're responding back to my comments. Just helps the flow of what's being discussed. And I can see that some people are started doing that already. So I want to introduce the team today. I'll be co-facilitating with John Callas, who will be doing a presentation with us today as well. And then we've also got Ben Bray, who will be doing a presentation on the challenges and opportunities within AI within healthcare. And in the background, I want to also say hello to Pardeep, who's been very helpful in supporting setting up this session. Pardeep will be our technical support, so if you've got any questions or are struggling to get to audio or anything like that, please let Pardeep know using the chat box and with the @ symbol Pardeep, and he'll be able to help you. Now, we'll also, although we're having a conversation here on this virtual community using WebEx, it's really important that we have a conversation with our colleagues that are not able to join us for various reasons. There's a number of events happening, and a number of other virtual sessions that are happening within healthcare at the moment, so not everybody can prioritize their diary for this. We want to use the hashtag AI community to connect with people on social media. And we also want to have a think about how we can continue this conversation post this first initial WebEx. A number of people have messaged directly about the use of technology tools like Slack, or thinking about using Facebook groups, etc. And I would really like to put that back to you guys that have joined us today to see if there's a preference to the type of technology that you would like to use, or if you have any other suggestions about how we can communicate in between having live sessions. And we'll come back to that at the end of today's WebEx. Just to get us started, I'm going to make it a little bit interactive. So for those of you who are in front of your laptop, I'm going to give you access to be able to access some annotation tools, which will be over in the top left-hand corner on your screen. And you'll be able to see that with an arrow, a T sign, a line, and a square. And with that, you'll be able to identify where, clicking on your arrow, you'll be able to say where you're from. So I'm here in Birmingham, or just kind of get a feel as to where people are. And I know some people might also be coming from international. If you're outside of the British Isles, feel free to point elsewhere on the screen. So concentrated effort there in London. But actually, we've got a diverse range of people from across the country, which is brilliant. And this is something that we want to keep growing. I'm just going to give it another second so some people can add. Okay. Now, let me just clear that and go to the next screen. So today's agenda is basically quite loosely, I'm going to talk a little bit about why we're here. Then I'm going to hand over to John, who's going to talk about what is AI and horizon scanning. And then open it up to you guys to have a conversation, add any questions, or anything else that you'd like to know more about after that. We'll then hand over to Ben, who is going to have a conversation with us about the opportunities and challenges of AI within the NHS, which I'm sure we're all looking forward to having an interesting debate and conversation on that. And then what's next for us as a community? What is it that you would like to see us doing? What would you like to do and talk about will be next. And just to give just so we understand where people are coming from, we've tried to create a scale here as to understand those of you who are joining us, how confident are you in the understanding of AI? And once again, I'm just going to give privileges so that you can annotate on this document as well. And great. So we've got a very, there's some people I'm seeing there being very polite about themselves, because I know they've been doing quite a lot of work in this industry. So I think there's an opportunity here for those of us who are keen and interested to have a collaborative conversation with those who are seem to be doing some really interesting work and expertise within AI, within the industry itself, but also within healthcare. Now, the final question I want to ask is, just so we have an understanding as to the types of people we're talking to today, what sector do you come from? And just get an indication to, is it NHS organisations? Are you coming from social care, charity, research? Are you providing vendor services or consultancy services, or are you other? Brilliant. Okay, so we see within our health system, we probably need to get some more colleagues from social care engaged in this conversation. But it's great to see there's a number of colleagues from the NHS, a couple of vendors, and also some others who will be able to accelerate our understanding and collaboration on this particular subject. But we do have a couple in there from some social care. And then also, because this is not just about us that are presenting today, it's also about you guys as a community. we want to really think about what it is that you can bring to the table as well. Do you have current examples of stuff that you're working on? Are you thinking about ethics and regulation? Are you thinking about contracting? Is there other things that we need to be thinking about? And feel free to comment all over this, but also add into the chat box or message us directly as something that we would like to look at for ongoing conversations. I'm sure we'll come back to this towards the end as we start talking about this subject. Brilliant. Okay, yeah, so we're going to have quite a lot to talk about, I guess, over the next couple of weeks. I'll give that another second, see if anybody else wants to add on that. I'll just check chat box as well. Okay. So if you do have any things that you're interested in or would like to give visibility to, please put it in the chat box as well, just so we can be aware of that. As John's mentioned, it's just there now. So I work in a team called Horizons. We do a number of different types of engagement programs to help look at large-scale transformation. And one of these quotes that we really like in terms of the law of new power is that although there's a couple of people presenting today, actually it's the expertise of the audience is greater than the sum of those that are presenting. So the collective knowledge that we can bring together that will help us all learn. And what we're also keen on doing going forward is making sure that we're also taking care of the relationships amongst us all, because this is where those of us that are excited about the use of the new technologies that are available to us will be able to see some results that follow on from there. And you don't have to be in a positional power of authority within an organization to have any influence. What we found recently through some research with an organization called Innovisor, who have discovered that just 3% of people within an organization are typically driving conversations with 85% of the other people. I'm just also seeing that there seems to be a technical issue with the chat. So I'll message Pardeep now in a second once I finish this last bit. So the final bit I wanted to say as well is that although there's a lot of documentation and there's a lot of reports being written around artificial intelligence and what's possible within healthcare, from our research and from our understanding, we're the best way to spread knowledge. It's 14 times more effective to have a conversation, and that's what we're hoping to do today. And when it comes to any large-scale programs of implementation, what we've also found is that the failure of the transformation is not down to the content or the structure of the plans, but rather it's about our informal networks within our organizations and those outside of it. So to make change happen, we need to make connections of networks of people who want to contribute. And I can see that a lot of people are engaged in this already. So we're looking forward to moving this conversation at an accelerated pace. I'm just going to hand over to John, who's going to talk about his section. Let me just make him a presenter. And then I'll also try and get the just getting, sorry, one second. There's another WebEx going on in the background. John, are you there?
I am indeed. Yep. Can you hear me?
Loud and clear. Yeah.
Brilliant. Thank you very much, John. Wonderful. So, yeah, it's a real pleasure to have this opportunity to talk with you all today. I'm going to scan through quite a lot of information. I've got a slide deck to present, and I'm not going to be able to really cover all of the things that are on these slides. I'm hoping that they'll serve as a reference point for conversation moving forward. And you are very much welcome to give any feedback that you would like. So, yeah, I'm really going to sort of go through this at quite a pace because Dom and I are very keen to maximize sort of community voice, and there's a lot of experts in this space. So just quickly to introduce myself, I'm John Kellis. I'm an innovation and community engagement consultant who works with the Health Partnership, the Bristol Health Partners, which is a local authority, three healthcare trusts, 3 CCGs and 2 universities. and I've got a real growing interest in AI. Over the last 6 years, I've been working with Christopher Ray and a team of volunteers on a data modeling and visualization engine, but that's a conversation for another time, perhaps. So, artificial intelligence, AI. There are a number of things that have an AI acronym, and one of them is the three-toed sloth. So I think it's always nice to sort of be a bit playful with things, particularly when they're complex, and AI can be very heady and heavy. So thanks, Sloth, for being so cute there. Artificial intelligence is used as a term and concept differently by different people. Smart machines, that's sort of basically what we're talking about. Narrow AI, simple AI, applied AI, weak AI, the idea that there can be intelligent algorithms focused on specific tasks is something that people are increasingly aware of, and these narrow AIs are increasingly being used. And through this conversation, I think we'll be focusing quite a lot on what could be called narrow AI. But there is also what could be called AGI, an artificial general intelligence. And I think it's really key to get some disambiguation from the outset that AI, as is often discussed, particularly in the technical community, is not necessarily the same as an AGI, but often in the lay community, they are seen as synonymous. So, yeah, just to mention, you guys do have access to all of these slides. I think at the top of the panel, you can sort of click through. So, as mentioned, I'm not going to speak to all of the points, but they're there for your reference. So, machine learning, it's not synonymous with AI, but it is currently the sort of key approach. And there are a number of machine learning techniques, including neural networks, which is sort of synonymous with deep learning. There are philosophical sort of questions when thinking about what AI is. MIT has got some available course material, and I found some of the questions that they raised to be very useful. The term AI also refers to sort of products, of course. So intelligence. There are a number of frameworks of intelligence. One author suggests that successful intelligence is really the only key metric that we can judge individuals by. But over here on the right, there's a framework of different domain intelligences. And I found it really useful to think about how the classification of human intelligences might apply to AI. Over here on the left is a simple picture of a machine learning system. R2D2 here is perceiving from his environment, or her, excuse me, to have a gender-specific pronoun, and then is acting. And this loop of learning from one's environment and learning from one's actions in that environment is a sort of core concept really in machine learning and AI. By looking at the types of intelligence, we can sort of begin to see that currently AI is quite far away from sort of existential insight, arguably, but we do have very sophisticated logical and mathematical AI-capable technologies. There are a number of health-related domains that narrow AI systems are currently being used for. I'm not going to read through this list here. I'm sure that you guys in the call are aware of many, if not all, and probably some that aren't listed here. But that, to my mind, is quite an interesting, succinct list of some of the areas of value that people are beginning to sort of explore. There are a number of AIs, emerging AIs in the startup, SME, and it's not just sort of small and medium enterprises, Google, DeepMind, IBM, Watson, etc., Microsoft sort of making moves in the space. There are lots of different AIs that are addressing health. I'm not going to go through this, but it's an interesting visual taxonomy of the sort of domain-specific focus of these products. In the Eventbrite invitation, it was mentioned that we were going to briefly consider AI and BI and another couple of thematics I'll come on to in a moment. AI and BI is surprisingly not considered together as often as I had sort of imagined it might be when I have been doing research, particularly gaining insight into the unknown unknowns and how AI and its natural language processing capabilities can present this sort of complex and otherwise seemingly abstract information in ways that humans can understand are two sort of functions that AI is really going to increasingly help us with BI. These three things here, three sections, this text and these two images are scraped from big sort of consultancy think tanks, and I think that these strategic planning assumptions by Gartner are quite telling of the sort of growth and the increasing focus on how AI can work with BI. The idea that 90% of modern BI platforms will have AI embedded by 2020, the idea that having curated catalogs of internal and external data that's accessible to people is going to massively unlock BI, and the idea that citizen data scientists are going to, as a sort of population number, grow much faster than the number of formal data scientists that are employed. The idea of an extranet and sort of working with wider communities, I think, is, to my mind, sort of quite key. Here's a selection of CB Insights sort of top BI and AI tools. Of course, AI is not necessarily synonymous with analytics, but I have taken this from CB Insights AI review. And over here, there's a sort of visual mapping of some of the analytic systems, many of which do now have AI embedded, for example, SAP and others. AI and diagnostics, there's loads of stuff happening in the diagnostic space, to name but a few. Locally in the UK, Babylon's just received quite a lot of funding. Internationally, the Human Diagnosis Project is gaining real traction. For me, that's a really exciting project. I'm excited by all of this stuff, but recently I've sort of been looking into that. Moving on, augmented reality and virtual reality, it's booming at the moment. Down here there's a little note that the predicted growth of AR, VR is at an annual cycle predicted to be 121%. There are a number of benefits that have already started being realized from a plethora of products. I look forward to pulling together resources as a community and sharing them with each other. For this sort of lightning presentation, there's not really the space to go through the available products and the projects that are happening within our public sector and community sector, as well as the commercial space, of course the third sector too. Moving on, there are a number of risks: accuracy, reliability, security, privacy. Yeah, vendor lock-in. It's just a note on the importance of being aware of the different business models behind the products being offered and what they can implicate as we move sort of into different phases of service delivery. I've heard the term future-proofing used a fair amount, so I don't want to take up much more time. Health, social care sector. In fact, I'm just going to sort of that message of potential impending doom is somewhat sort of balanced out by the OpenAI initiative, which I'd recommend that people have a look at if they're not already aware. Loads of data, metadata is important. You're able to access these slides if you would like. I'm going to come to a close in a second to make room. Data is the new oil and it's the new soil. It can power things and help things grow. Public ownership, is it viable? Is it important? There are a number of considerations that I hope that we as a community that is not sort of beholden to a sort of profit-seeking agenda, which is not necessarily a bad thing, but there's a number of opportunities, I think, for a community of sort of mixed professionals. And that's it for now. Thanks.
John, thank you very much, and very well put together. I'm just going through the chat room here, and I think there's a number of different conversations that this is starting to spark. A number of people messaging me directly as well. I think one of the interesting bits that seems to be coming out is the bit around ethics. Matt and Lizzie and Co are talking about how can we make this a more open conversation, and Mark has also been talking about some of the MOOCs that are currently available for us to get our head around some of the language around AI. Does anybody want to come in on that at all? Just as we're getting Ben ready for the next session.
Yeah, those thoughts I think are really pertinent. Sort of available course material and communities of sort of interest in learning and practice that already exist. All right, I think I hear another bit of background noise, so I'll stop talking.
Okay. Ben getting ready for the next session. So I think we can come back to this after Ben's session, because I think there's a number of challenges that we need to face. I know that in some of the conversations, I know that Hugh's on here as well, Dr. Hugh Harvey. We've been chatting about some of the stuff around radiology and around data sets. So I think this is a pressing issue that I think we can come collaboratively on to pressure the system to think about its IG, etc., and access to data. Ben, are you there?
Can you hear me?
Loud and clear.
Ah, fantastic, good. So I managed to unmute myself, but also lose the slides simultaneously.
Okay.
But that's okay. I can remember what's on them. So so my name is Ben Brown. I'm a public health doctor and researcher at University College London Fart Institute of Health Informatics, and also research director for Sentinel Stroke National Audit Programme. So I've just got a couple of slides on the sort of opportunities and challenges for AI and machine learning. And I guess the first point I wanted to make was just to elaborate a little bit on this distinction that John talked about, which was machine learning as being a subset of artificial intelligence. And I think the language is quite important to make it clear what we're talking about. Partly so people know precisely what you mean, but the thing about it is that we've probably had efforts to introduce artificial intelligence to healthcare for decades now. People started to build the first systems in the 1970s. And if anyone who's been to a GP or hospital recently will know, there are hardly areas where AI seems to have been implemented widely, for reasons you might want to talk about later on. But what has changed and why there is much more interest in this now has been particularly the rise of machine learning as a subset of artificial intelligence, driven by increasing accessibility of data, better hardware, and most particularly better methods for generating machine learning algorithms. In a sort of big picture sense, I think there's tons of opportunity for machine learning in healthcare and within the NHS specifically. And so the key underlying driver in healthcare, as it is in other industries, is the opportunity to increase productivity and to automate aspects of data-driven interpretation and decision-making traditionally done by humans, and to help us to make better decisions along the way. And the idea, so this is the destination where it can help us go to in healthcare, so moving from a model where healthcare is largely episodic and static to something where your healthcare becomes more predictive and dynamic. So stuff happens, it's not just when you're sick or when you see the GP, things are happening in the background, your data is being interpreted, your health is being supported to be improved continuously. That's a big picture. And the good thing about the NHS has got many advantages why it's a good setting for developing this technology. First of all, as a universal healthcare system in a relatively populous country, there's opportunity potentially for quite rapid national scale up. And secondly, there's loads of data resources in the NHS, and the NHS is quite rich in terms of data. And I put some of those in the in the box there. I'm not going to elaborate too much on there, but I think it's worth highlighting there's different types of data we can draw on. So there's a variety of real-world data sources in healthcare, more than social care, that we can draw on that exist both at the national level. So, for example, hospital administrative data or clinical registries. Clinical registries are data sets on specific patient populations or people with a certain disease or a condition, and it's generally collected in more detail. So, for example, we've got detailed national registers for patients with myocardial infarction, or for stroke, or who've had a hip replacement, for example. But it's also worth thinking about other types of data we can use to help to start to build our machine learning systems. One sort of untapped area is a previous research study, so trial data sets and data collected from previous research studies that could be reused for training machine learning algorithms. And then thirdly, sort of emerging data sources. So varying, can be incredibly wide. So for all the different things that might impact on our health and well-being, so I put transport there as a sort of random example, but anything across education, a kind of commercial sector, things in the world around us influence our health, the emerging world of person-generated data through devices, IoT, etc. Use of medical technologies, so genomics, for example. There's going to be loads more data in the future for feeding this type of stuff. And as John mentioned, there is a lot of interest in machine learning in healthcare. And I think in the main areas it's currently focused on is kind of three main areas. So first of all, diagnostics. So that is interpreting medical images. So for example, detecting a tumor on X-rays, or detecting tumor cells down a microscope, looking at pathology slides, or looking at retinal photographs to detect eye disease. So that's the diagnostics realm. Secondly, there is a lot of interest and investment in machine learning in medical research at the earlier stage, so kind of drug discovery, finding new treatments and preclinical research. And thirdly, in the area of natural language processing, which includes things, for example, like chatbot interfaces for medical services, or for systems to translate our terrible, unstructured medical records into something that can be more easily interpreted by computers. But apart from these areas, I think there's a lot of untapped potential in areas that probably may seem less obvious. And I think lots of this I would class as the unsexy business of healthcare, the sort of back-end stuff, where I think there's actually lots of opportunity, partly because there's lots of data, partly because there's lots of data-driven decision-making in this space, and also all this stuff is one of the reasons why healthcare is so expensive. So lots of the spending on healthcare is in this back-end stuff. So operational decision-making, measuring quality and safety, logistics, HR, potentially for new, very disruptive models of healthcare that's very different from things we do currently, and opportunities for task shifting. So that's helping changing people's roles and skills by giving them better tools driven by machine learning to do things they couldn't do before. That's quite a topical area given the training challenges in the NHS currently. So I'm just going to move on to challenges. Dom, I still can't see the slides, so can you move on to the challenges?
Yeah, I've done that for you now.
Fantastic. So not wanting to be seen too negative, but there are, I think it's important to talk about the challenges to this stuff. So one of the big challenges we face is that we have lots of data in healthcare. Lots of it is not entirely suitable or most suitable for machine learning. And one of the big aspects of this is that for generally the most powerful types of machine learning algorithms, what we call supervised learning algorithms, need to have what we call labels, so outcome states. So they basically need to know what is the ground truth, what is the ideal they should be aiming for. So imagine, for example, you're training an algorithm to interpret, to automatically recognize pictures of dogs and cats. You want to give it a data set of dogs and cats and told it what's a dog and what's a cat in advance so it can train to do that. We actually are quite poor in medicine at having data sets that are labeled appropriately, and that is a big challenge. there is a very complicated regulatory environment, both for the collection and use of healthcare data and data from patients, and similarly a unclear, evolving regulatory space for the use of algorithms and algorithm-supported decision making. Something we can talk about later on, but it's going to become a very pressing issue how we regulate, quality assure, and monitor the safety of these systems. I think the final point I just wanted to pick up in terms of these, a couple of words to do. So part of it is the funding. So although there's lots of research funding in the kind of commercial sector, having done a very quick and dirty look at what are some of our leading R&D funders in the public space, the NIHR or the Medical Research Council, have traditionally not invested much money in machine learning and AI systems. Hopefully that will change in the future, but it would be a lie to say that we've invested in it consistently over recent years, and that obviously has implications for our capacity to develop new systems. The other bit about it is the issue of implementation. We know that new technology is hard to implement, and even if we have the most fantastic algorithms that have the most fantastic predictive or classification ability, to actually implement them in real-world healthcare settings is going to be very challenging and require a specific skill set to do so. And I guess lastly, the kind of thing drawing us all together is currently in the NHS, we don't currently have a strategy to develop and implement machine learning and sort of the big data that hopefully would drive machine learning in the future. Currently, one would probably address the sort of things I've talked about in the challenges, and it would be very helpful for that to happen relatively soon. So I guess I'm going to wrap up there, and we can take questions and continue the discussion.
Ben, that was great. Thank you very much. I think flagging a lot of interest around various bits as to how we're collecting data, making sense of it as well. Does anyone want to come in with any questions at this point, just to I think there's a number of comments there, maybe more for Andrew, and go through some of the comments here. So Mark's making a comment about, so what are the business models that underpin an effective and sustainable commercial proposition? And do we think the NHS has a receptive commercial context, or is the leading way going to take place in private healthcare and the insurance market? I guess we individually might have some opinions around that, and also Andrew's making a comment that you make some great points about opportunities, but what is it that we can learn from other countries? What do we need to do to accelerate that? Do you have any thoughts on that? You've got some of those challenges around, like you've got some opportunities with NHS strategy and investment in the data. Do you see any signals that might change this conversation?
I think in terms of the NHS as a specific market to support SMEs and companies investing in this area is complicated. I suspect the picture is probably mixed. So the NHS England certainly has made definite efforts towards improving, or active efforts to try and support the uptake of innovative services and technologies. When the NHS has got a number of schemes to do so, and has got a lot of positive rhetoric and kind of policy direction in terms of supporting innovation. So all fantastic. One of the things that makes it a little bit difficult is, well, things that are quite difficult indeed, partly is the funding situation. So currently it's hard to get commissioners to invest in new services unless you make a very good case for the financial value of the innovation. And to be honest, if it's not obviously cost saving over a relatively short time horizon, it's very hard to get space in the room to try and invest in the stuff. So the money thing situation. And secondly, there's sort of a political risk aversion that we've seen recently, a sort of topical thing recently about the hospital Airbnb Southend news story is, I guess, because the NHS is by its nature quite political. It is sensitive to negative stories, and I think kind of the political risk from damaging or controversial news stories is something that I think would probably make investors wary, I suspect. But I don't know, I'm interested in what other people think about it. So yeah, I think it's a mixed picture, but lots of potential.
Yeah. I'm also going to ask Matt Finnick to come, and has come online now, just trying to make him a presenter. He was having an interesting conversation with Alison. Let me just try and do this.
Hi,
Matt,
can you hear
me?
I can, yes. Can you hear me?
Yeah. How are you doing?
Good.
We were having an interesting conversation in the chat box there. It'd be good for those that aren't able to see that, to talk about some of the things you were talking about with Alison and co.
Sure. So I think really we're talking about medical ethics. Particularly, we settled on issues around the use of data. And really, I mean, my own background, as I said, is in clinical academia. So I have experience before moving into the policy world of recruiting patients to clinical trials, of getting informed consent. And it struck me really how we have good frameworks for this. Alison mentioned the sort of medical ethics and the IG around sort of the normal ethical frameworks that we use in research. Now, that might be a good model to follow, but obviously those regulatory demands are pretty onerous and expensive, in fact. And my question really was how do we get buy-in from smaller, more disruptive type startups, health tech type enterprises into subscribing to these onerous regulatory demands. The one thing I will say is, as part of my sort of policy research, I've spoken to lots of people in health tech and other forms of AI startups and SMEs, and they are actually quite keen on, not regulations, certainly on having the boundaries of a framework mapped out, so they know that if they operate within that boundary, they know they're safe. They certainly don't want to have issues like we've just heard about sort of the political backlash from the Airbnb story, also the backlash after care.data. And those are sort of cautionary tales, really.
Yeah. Thanks very much, Matt. I'm conscious of time. We've got about 15 minutes left. A couple of closing remarks to come to. Do you have anything else I would like to say to that? I guess things that's on my mind at the moment as well in terms of conversations that we have is, yes, there's an education in terms of what AI is, but I know that me and John have been having this conversation around, instead of saying artificial intelligence, maybe it's augmented intelligence, when it comes to supporting the workforce in their decision making. I don't know if anybody has any insights or are they addressing some of that. Yeah, you can come in on regulation. Yeah, give me 1 second, I'll just make you a presenter. Second, as my computer slows down.
Hi, can you hear me?
Loud and clear.
Hello, can you hear me?
Yeah.
Yep, great. Hi. Hi guys, I'm Hugh. I'm a radiologist, and I've worked at Babylon, and I've worked in the regulatory space, and I've worked quite closely with the MHRA, who are the UK governing body in regulations around medical devices, and also the FDA in America. And I think the current system around regulation of software isn't fit for purpose for AI, and the regulatory bodies know this, but they don't know how to go about regulating AI as we move forward. And there are interesting conversations going on about forcing, or not forcing, but making sure that SMEs and big companies who are in the AI space in healthcare go through a quality assurance process first before launching to market, but then have very good post-market surveillance and audit in place after they go on market. And this is because AI is constantly updating, and the algorithm is constantly learning, and therefore you can't do a clinical trial every single time you add knowledge node or improve your algorithm by percentage. So they're looking more at market surveillance and how you are auditing AI live in real time. And I think this is going to create an entire new industry around the monitoring and audit of AI in healthcare. And it may be that we need to develop new, different AI to help monitor clinical AI. So I think it's a very exciting space. So that's all I wanted to say about that.
No, I think that's very helpful. It informs this initial conversation. There's a number of people that are joining us with different understanding as to what's happening in the marketplace. That's very helpful. In the last few minutes, I just wanted to for presenting and those are comments into the chat box. And I'm just going to spend the last few minutes just talking about. Let me just make myself a presenter again. 1 second. Take control of the slides. What would people like to know about next? So what we've tried to do is establish working to start talking about what's happening in led by how we work within the NHS, but being supported and being opened by all the different vendors and various people that are in this space already to try and close the gap between us all a little bit. And in terms of our education as a system, is there anything that maybe I'm interested in doing in that kind of presentation currently doing? Could you message us in the chat box or message myself directly, John and Ben, and then we can maybe have a discussion about what we do going forward. Yes, I think you're absolutely a registry of who's doing what in AI and healthcare. And maybe that's something that we could work on together. And yeah, some case studies, absolutely. So if anybody has the answers to some of these comments that are coming through, let's we're not asking you to be an AI expert, but if you have some knowledge that you would like to share or some research that you've found, please have a conversation with us about just keeping this quite informal and creating a learning network amongst us. So one thing we also want to talk about was how regular shall we meet?
Hello everyone, Pardeep here. Dom's having some technical difficulties at the moment with the WebEx. Basically his laptop is frozen. So I'm just going to wrap this WebEx up and just say thank you everyone for joining. I will feed back.
Hi there, Pradeep. Pardeep.
Yes, hello.
Would you mind actually, because it's quite a valuable thing to have people engaged, it seems worth sort of just seeing if there are some additional.
Last night when she went to bed, but she didn't have any this morning.
Oh. So someone's audio is is still on in the background. I heard something about a meal last night. Paddy, so can I think that I'll just sort of continue fleshing out some of the things that need to be considered for a few minutes, if that's okay. I don't know if that's your background noise, but if you wouldn't mind.
No, it's fairly quiet here, so it's definitely not me.
Interesting.
Okay, so what I'll do is I'll let you carry on, but Dom's got the presenter's ball at the moment, so I can't actually change the slides.
That's okay. Sure.
So that's fine. Okay. Cheers. Okay,
thanks. So I just want to invite people to share any resources that they think that it's important to give visibility to in this chat thread, and to also mention that Dom and I have been collating resources, and I think that there will be a Google folder, a Google Drive folder, that we have collated resources that we can share. If people are happy to have their contact details shared, then please share it in this chat thread for now. Otherwise, in the next session, I think Dom and I will have a communication with the contact list that exists. Dom's got access to the full sort of mailing list, but for now, we won't be sharing the mailing list with the participants. So if you would like to give visibility to yourself, to this community, please do just mention it in the chat channel, and we can perhaps share your contact details following the event. So we are now in a situation. Thank you, Benjamin. Wonderful, that's great, Lisa. So people are starting to drop some contact details in there. So Chris Lawyer has just written that it seems we need a systematic definition of value propositions independent of technology, which AI can address. Currently, a tech-driven approaching for needs is muddying the opportunities and creating confusion about how and where to proceed. Yeah, very interesting. I'd agree with that. Being needs-led is sort of crucial. So I guess that could be articulated as a sort of clear invitation to this community. If there are particular areas of opportunity to sort of help and make things better, so what are the biggest challenges? I mean, I don't mean to sort of be flippant, but in Bristol, parking around hospitals, for example, is quite a challenge. Data and AI in relation to health and social care is not just information about individuals' health. It's also sort of conceptually reasonable to include information about the sort of delivery of services and availability of services. Great, so more comments coming in. There are a number of case studies that Dom and I have collected. We don't have a smart spreadsheet to share with you, but we will share resources with you following this event. And I'm really pleased that we've been able to sort of bring people together to discuss. Paddy, I'm not sure if I can give audio permission in this sort of situation of Dom having.
Hello, John. I've now got host rights now since Dom has dropped out of the WebEx, so I can give audio rights to certain individuals. Is there anyone in particular that you want me to unmute?
Well, it was great to have a comment from a colleague at Health Education England, and in terms of needs, it strikes me that there's quite a lot of interest at Health Education England to develop training materials. There's a clear need for a skilled workforce, and potentially the data sets to do with training materials are different to sort of patient-related data, and the possibilities to leverage AI and machine learning on sort of training materials seems to be an area of work that is less problematic than other patient-related data. So there's a sort of targeted invitation to colleagues from Health Education England if they would like to speak, or if anyone else would like to make use of the last couple of minutes that we've got. So we'll finish promptly at 2, but because this is a sort of community space, the plan was not for Dom, Ben, or myself to sort of dominate with talking, but to sort of host a space that people can raise questions, share ideas, etc. So if anyone else would like to have the mic for a minute. Well, so Janet Davis, thank you for that question. And Paddy, Dom's asked if you can make him a panelist again.
Yep, I've done that.
So that's great.
Thanks for jumping in there, John. Apologies about that. My laptop completely crashed on me just as I was getting into the swing of saying thank you to everybody as well. Just to answer one of those comments there about Slack, what we're thinking about is how do we keep in communication with each other on a regular basis. And Slack is a messaging tool where we can break down conversations into channels, so we can share some of the, whether it's ethics, regulatory examples in various channels. But happy enough to be led by people's comments here in the chat room. And was there anything else you wanted to add to that, John? Just obviously I disconnected there for a little bit due to my laptop. So
no, it's great. I mentioned on while you were away that we'll circulate some more of the resources that we've been collating. I think that we're both keen to sort of present information in a curated form, and there's sort of so much out there. It's an interesting challenge to curate this information. But no, I just wanted to say thank you to everyone for joining us, and I'm really excited to continue conversation with you all.
Yep. Likewise. So thank you everybody that has been able to join us. A number of people, like I said, had conflicting meetings today. So we'll be sharing some of this with those that weren't able to make it, and look forward to keeping the conversation going. It looked like that the poll for a monthly conversation dominated the results there. So let's figure out what we can do in a month's time, what we want to talk about, and let's keep the conversation going amongst us, and look forward to the next session. Thank you, everybody.
Brilliant. All the best.
Thank you, everybody, for your day. Have a good time.
Take call.